In 2021, we were all asked a question about providing help to others in the census. That information helps us pinpoint local needs. It helps us understand what's positive and what's problematic about caring, and it helps us understand who is providing care to others and who might need support. We spoke to experts in the field about how they're using information from the census about caring.
We use this data in just about everything we do. For the first time, we could really say with our hand on heart, there are this many carers in the country, local areas. We could suddenly describe the population of carers in real detail: age, disability, ethnicity, faith, housing situation.
There are so many more carers than people realise, and to be able to provide hard facts from government data to explain the number very often shocks and surprises people, but also engenders a great deal more empathy and enables us to have much better conversations about how commissioners, employers and other organisations involved in health and social care can really support all of those carers to do the challenging role that they have.
We analysed the Office for National Statistics longitudinal study, which is a study that links censuses for England and Wales over time. The key finding overall was that there's a complex interaction between caring and health, where the line between providing a little bit of care which keeps you fit and providing quite a lot of care which could adversely impact your health is quite thin indeed.
One of the things that we use the census data for is to help us with planning our service delivery. So it's really useful to have a good idea of the numbers of carers, where they live, and some of the key demographic characteristics. We also use it for our influence work when we're trying to influence policies either locally or even nationally.
We were able to have, I believe, a significant impact on the legislation that was passed in 2000 or came into force in 2006, the Work and Families Act. And for the first time in that legislation, carers were specifically given the right to request flexible working. And until then, it had only been parents. And the evidence we were able to build from the census had a key part to play in that achievement.
The census data in 2011 reveals that there were 60% of carers living in Bath and North East Somerset who were female and 40% who were male. When we compared that to our data, we realised that male carers were significantly underrepresented in terms of the carers who we were supporting. And that enabled us to reframe some of the services that we were offering.
We know from the last census that the largest minority ethnic group of carers in Sheffield are those of Pakistani origin. So as a result of that, we created a post specifically to engage with carers from that community and an advisor who speaks Urdu and Punjabi.
Our own research findings were referenced in a 6-page report on the latest evidence on unpaid care, which was put together by the Parliamentary Office for Science and Technology, and then it was distributed to all members of Parliament in Westminster. The key message of that report was that the provision of unpaid care has a direct impact on the carers' economic activity patterns and health status.
We use it to talk to carers, so we tell carers about other people and their lives. We use it to talk to policymakers, locally and nationally, in policy briefings, to parliamentarians, ministers, to the media. I know that every single local authority uses the census to plan and think about services for and with carers, and that will be exactly the same after the 2021 census.
So we are planning to continue research into how caring patterns have changed, and we're all interested in the same types of questions. We're interested in the characteristics of the caring, the intensity of care provision, as well as how it impacts on the health status of the carers.
Carers feel incredibly undervalued and they don't feel visible in society. And the census is a way of bringing their needs and their voices to the fore. As a carers organisation, Carers UK will be looking to share all of this information and involve carers in the work that we do so that they feel that they own these results too, and they can help us to bring about the change that they so desperately need in their lives.
If you're involved in providing services at local or national level, the census provides vital information that you need. Once accessed, it has the potential to make life better for millions.